and welcome to Animalia the Podcast. I'm Natasha, and thank you so much for tuning in. Animalia is back after a little break, refreshed and ready to go. We are keeping our promise of sharing vital information for every pet owner, and this episode is no different. Animalia extends our condolences to Kimlin Harilal, the cat sitter, who appeared on episode 2. She recently lost one of her babies, an adopted but older stray she called Mr. Gray, to a feline urinary tract disorder, a common ailment in the male of the species. So we will share everything you need to know about signs and symptoms, prevention and treatment of these painful and at times fatal infections. Our guest this week almost lost one of her babies to a UTD, so the subject is near and dear to her heart, which is a tender one for animals, as you will hear during this interview. Please welcome to Animalia, Dr. Fix-It, Dr. Shirelle Sammy. I am very pleased to welcome Dr. Shirelle Sammy to Animalia, yet another vet we have the pleasure of speaking with. And before we get into the real meat of our discussion, why don't you tell us a little bit about yourself in terms of when you first became interested in animals and why you decided to become a vet?
All right. Well, my name is Shirelle Sammy, and I graduated from School of Veterinary Medicine at the University of the West Indies in 2014. What really gravitated me towards veterinary medicine or animals is that at a very young age, I would get a little bit personal here because it's the earliest memory that I remember my love for animals. I lost my dad when I was 3 years old. And at that time, you didn't understand death. You didn't understand anything. But a lot of my family would have me read the Bible, pray a lot. And something stood out to me in doing that, Genesis 1:26, where, God made animals and then he made us to take care of them. And at a young age, I thought that was a very easy job to do because it just seemed natural for me to gravitate towards them, try to take care of them. So at a very young age, I felt like I knew my passion and my love, and then I was guided towards it very quickly. So my entire life was very streamlined towards that. And I would have done all the research. I would have volunteered at different places. And I think that led me to where I am now, where for me it was just very easy and I gravitated towards animals. And I felt like, great, I was told what my purpose in life was and I just followed that.
Okay, so where are you practicing now? Are you with a clinic or on your own?
Yes, I work in a clinic in Digger Martin, Sunnyview Vet Care Services. I've been there since December 2018, and it's really, really great place to be. I'm able to do a lot more and diagnostically help animals to the best of my ability. We mostly see small animals such as dogs, cats, but we do see occasional exotic animals such as guinea pig, bunnies, occasionally monkeys.
Not pet monkeys.
Actually, yes, we do.
Okay.
But not a lot. If I see two, I see plenty. And of course, we do have to be aware of the fact that permits are required for them. I've had a client who rescued a pet monkey and didn't know that she needed a permit. We walked her through the process of doing so because when she went to get the permit, I think they noticed the close bond that the monkey made with her and granted her the permit because it would have been unjust for the monkey to then have to fend for its own after being cared for her. So there are a few exceptions. I absolutely hate the fact that there are pet monkeys out there.
Yeah, actually, a friend of mine was telling me the other day, I feel like I want a pet monkey. And I'm like, but do you have any idea what taking care of a monkey requires? Because it's not like having a dog or a cat. I mean, this is a wild animal.
And they're supposed to be in the wild in a natural habitat and free. So I'm a big advocate for wildlife, and I actually worked in forestry division for a short bit when I was in vet school. I got interned. And I appreciated wildlife. We went to see turtles nesting and all those things. And it was just good to see them in their natural habitat without our interference and flourishing well.
But it's good to know that at least there are regulations guiding this kind of pet ownership. I know that there are people who have pet monkeys and other exotic kind of animals, but at least we do have some regulations in place for that. So what are some of the challenges, some of the rewards of being a veterinarian in a clinic like yours? And what is it like dealing with the human and four-legged or sometimes two-legged animals that you deal with?
The major challenges, or I would say major challenge for me, is always losing a pet, always losing a patient. I think is one that gets me very choked up and takes an emotional and mental toll for someone like me because I care so much. And when you want to fix and you want to help and you want to save everyone, when you lose one, whether it be in a form of euthanasia or a very sick pet who passed away from cancer, or just his quality of life has diminished over time and he went silently, it does take a toll. And sometimes there are healthy pets or apparently healthy pets that also don't make it through surgery. And it just takes one big turn for me. So I would say that's my major challenge. Everything else I'm able to work through, I'm able to overcome, but I could never really overcome when a patient that I've bonded with and have become a part of our family as well, and they're no longer with us. I know it's part of life, but it's still hard to swallow sometimes.
I get you. And on that point, before you go on, given my experience with my pets dying, there's one particular case with my cat, Toro, was attacked by dogs, and I got him to the vet. And although she had never seen him, she tried her best to save him, and she was the one who obviously had to make the call to me to let me know that he passed. But what do you think that owners can do to, I don't want to say console, maybe that's not the right word or the right term, but how can we help vets to go through these kinds of challenges as well? Because and as much as I was sad and angry and frustrated, I'm sure she must have been as well. But is there any way that owners can help vets to go through this?
I'm really glad you asked that question because it shows me that while you are going through your own pain, you understand we are going through ours as well. Sorry if I sound like I'm crying. I am, because it's a really nice question. Just be understanding that we tried our best. It's all we ever wanted to do was try our best. And circumstances don't always allow that. And even though we may understand we have tried our best, we still feel like we could have done something else. We always feel like there was something else we could have done to have a better outcome. So in terms of from the owner's perspective, I would say just be understanding as much as you can. There are a lot of clients who, while we are also grieving for your pet, out of anger, I'm assuming they berate us, or they are angry and they shout, or they get abusive, or they turn to Facebook or some sort of social media platform and also bring us down in that way. So apart from dealing with the loss of a patient ourselves internally, we now have to see it outwardly on Facebook or on social media. And then we have to replay it all over again. That guilt, that hurts, and it just hurts. And while we do understand your loss, and it's easier to pass blame on us because we were the last ones or the last intervention or the last hope for them to help their pet. Sometimes, like I said, we would have done our best and it's beyond our control. Sometimes the injuries are too much, too severe, too extensive, or underlying, where I'll tell you something as simple as hypertrophic cardiomyopathy is a condition in cats where the walls of the heart are thickened. And you won't know that until you do an echocardiogram. But I'm just saying, you won't know on a physical exam because your heart rhythm will sound great. But you wouldn't understand that during a routine procedure such as a spay or a neuter, your pet passes away when apparently he or she appears healthy, but doesn't make it under anesthesia because when your walls are thickened, it compromises your contractility to get that blood out of your body, and anesthesia decreases your cardiac output. So I just wanted to talk about that a little bit because sometimes people will have their pet go into surgery and, they think that it's good, it's healthy. And if the pet passes away, it's automatically, once again, they're hurt, they are upset, and once again, lash out at us. Unless an autopsy is done, of course, we won't know the true reason why an apparently healthy animal can also die under anesthesia for something routine, such as spaying or neutering.
I was not aware of that either, and that is obviously a consideration. I mean, we're always told that there's a risk putting an animal under anesthetic, but I mean, in my case, I could not be anything but grateful for what the vet did and what she tried to do, because when I called her at 2:30 in the morning, she answered. So that alone was reassuring enough for me. But let's talk about something a little more pleasant now. What are some of the rewards?
Yeah. Thank you.
Some of the rewards of your job, and what is it like dealing with the animal and human clients?
The greatest reward would be for me is seeing that pet from, I would say, baby to an adult, through all stages of his or her life, and becoming a part of the human-animal bond interaction and creating that and sustaining it. So it's great when I'm able to see my patient grow up, and when they're sick, I'm there to help. I'm there to make them better. And for me, like I said, I'd like to fix things. So anything that I have fixed or I have solved makes the job or the career very rewarding for me. I feel like I've done my part and I have played my role, and it's very fulfilling for me.
So on to the topic of the episode, really. This was born out of some stories that I heard from friends who had cats with urinary tract disorders, and some passed, some survived. Tell us about feline urinary tract disorders, how common they are, and what are some of the causes of those disorders?
All right. So this is also a very sensitive topic for me as well, because I have a boy and he had gotten blocked, and I've had numerous patients that have been blocked. And just to go through the possible causes of them, I'll kind of break it down into causes, symptoms, or clinical signs. And then from there, we can go more into what can be done and some preventative things that you can do in order to provide your, mostly male cats are affected, your boy cats, what you can do as a pet mom to prevent them from being blocked as best as you can. And when I go through the different causes, you realize there's sometimes there's nothing that you did wrong when they do become blocked. So I will just give you some statistics as well and let you know that 50% of cats that are blocked are actually ones that don't have a cause that can be determined despite extensive testing. It's called idiopathic cystitis. If you look at that percentage, it's 50%, where you have no idea what would have caused it. 20% will have bladder stones, and another 20% will have a urethral blockage or a urethral plug. And then 1 to 5% will either have a true urinary tract infection, a urinary tract cancer of some sort, trauma to the urinary tract, such as being hit by a car or being a bit playful or wild and hit themselves either running or jumping within their home. And then you will have the same 1 to 5% being a combination of both a urinary tract infection as well as bladder.